Thank you for joining us for Ask a Therapist, the Blue Cross Blue Shield of South Carolina series in which we speak with mental health professionals about issues many people face every day. I'm one of your hosts, Ryle Curtis, and today we're joined by Dr. Zach Stroud to talk about the relationship between substance abuse and mental health. Dr. Stroud is triple certified in general psychiatry, addiction medicine, and adolescent psychiatry. Thank you so much for joining us today. Dr. Stroud, our first question is, how do you define substance abuse disorder?
Yeah, and that's definitely a good question. The kind of the technical definition would just be uncontrolled use despite negative or harmful consequences of any sort of substance. I think that this does become important now because what I do see as a practitioner is, with the medication-assisted treatment options, specifically things like methadone and Suboxone for an opioid use disorder, a lot of patients will say, well, I just don't want to substitute, one drug for another. And first of all, the agonist maintenance, Suboxone and methadone have been shown to be the most effective treatments for opioid use disorder. But if you are on those medications and you are able to lead a normal life, with no negative consequences, you've stayed out of harm's way, haven't been incarcerated, and if you're able to maintain employment, then theoretically you don't have a substance use disorder in the classic sense of the word. And I think a lot of times people really do mistake physiological dependence or body dependence on like having a substance use disorder. And I can kind of explain how this would be false is I could take the medication for propranolol, which is it's a beta blocker. So it helps with anxiety. It also helps with elevated pulse. And if I were to take that medication repeatedly for several months and then stop it all of a sudden, I would have a withdrawal process from it. My pulse would elevate. But, I certainly wouldn't go around thinking that I have a propranolol use disorder or abuse disorder. So it's really that focus on using despite negative or harmful consequences. It's important for everybody to understand.
And let's maybe have you talk a little bit about the mental health impact connected with substance abuse. What is the relationship between substance abuse and mental health?
This is they're definitely inextricably linked. I guess it is a little more difficult to discern because a lot of times you will see patients who have been using substances and obviously, they will kind of display in a different state of mind. So some people may think that he or she has bipolar disorder when in reality, he's just been using meth or he's been using cocaine. And obviously, that substance use can cause symptoms that are very similar to a bipolar mania, lack of sleep, increased, drive. We do know, obviously, that, those with pre-existing mental health symptoms, they'll also seek out substance use as a way to self-medicate. But it is also important to realize that for it to not fall under what we call a substance-induced mood disorder, meaning that the substances themselves have caused things like hallucinations or depression or anxiety or, a manic type behavior. You really need the symptoms to have begun prior to any sort of drug use, or you have to assess after the patient has been 30 days free of any sort of substance use. And so this really does come down to taking a proper history, a timeline, if we are going to distinguish between the two.
What are the most common signs and symptoms of substance abuse disorder and its negative impact on someone's mental health?
The most common signs and symptoms really do relate back to that initial question of how we define a substance use disorder. So uncontrolled use despite negative or harmful consequences. And so the biggest thing is we start to see, somebody pursue any sort of drug or alcohol at the expense of other normal functioning activities. So instead of going to work, somebody is now spending time seeking, an illicit substance. Or maybe somebody is falling behind at work or is not paying bills. So, essentially we look for that functional component, really that dysfunctional component to identify the underlying substance use disorder. But I do think that there are even, other things that can be seen, obviously the old one was, somebody had bloodshot eyes. They were potentially using, marijuana. And I do think that's obviously still a good marker. In addition, we do see kind of things like dark circles under the eyes for heavy cannabis use. One of the things that we're seeing now more is a lot of scars on the face of patients. And if somebody looks like they really had been scratching themselves a lot, that's very highly correlated with methamphetamine use. So the reason being that under the influence of methamphetamines, people tend to think that there are bugs crawling on their skin. It's a term that we call formication. And so they scratch. And as a result, they have scars on the body and on the face from excessive scratching. Another thing, too, that's a telltale sign, especially for adolescents, you start to notice like a red rash around the mouth, the nares or the nostril. In young kids, it's very indicative of inhalant use, which is, still highly prevalent just because most adolescents think that it's a kind of a cheap high. You can't drug test for it, readily available. So there are certain appearance markers as well, in addition to functional components to at least identify a substance use disorder.
Are there certain risk factors that make some individuals more susceptible to substance abuse disorder and mental health issues?
Yeah, the biggest one is just genetics. And so now with a lot of the data that's come out, and they've done twin studies, taking essentially the identical genetic component and determining substance use or people who are prone to addiction. The thinking now is that about 50% of addiction is essentially due to genetic makeup. So if you have a genetic predisposition towards it, you're certainly at the highest risk factor. And I think kind of a phrase that I've heard before is that the genetics load the gun and then the environment pulls the trigger. And so obviously genetics are a certain risk factor, but then environment is a big thing as well. Any sort of history of in-home abuse, very stressful environment, excessive poverty, those two all more highly correlated with substance use. Another very important one is parental modeling and just what's kind of going on in the home. And currently I'm a psychiatrist in a correctional setting. So in jails and prisons, most of the time, the substance use disorders we see in the jail, it's an extension of what was going on in the household with the parents. So the parents were using drugs, so the child has easy access, or alcohol, and it's just a continuation. Genetics and environment are always going to be the big issues. I guess within the past maybe 10 or 15 years, the idea of genetics playing an enhanced role in addiction has become more obvious, I guess, in discussing some of the risk factors.
What type of treatments are available?
Yeah, and this is I think probably the most important question, at least to relay to any sort of listener, because I don't think that people are aware of some of the medications that are now on the market. And I think this is because a lot of the screening does occur in primary care offices. I just don't know that primary care providers are available for cutting edge treatments. And so there are now FDA approved medications that can help with certain substance use disorders. And so if somebody has an alcohol use disorder, one of the medications is antabuse. So that's a medication that you get sick if you drink. There's also something else called Camprol, which can reduce cravings to use alcohol. And then probably the biggest one is naltrexone. And it has a monthly shot called Vivitrol that can also reduce cravings to use alcohol. Now, interestingly, on the opioid side, a lot of those medications are also FDA approved. You can give naltrexone, which is literally an opioid blocker. So imagine a baseball kind of going into a glove. And that's how a normal opioid would work. If you were to take fentanyl, kind of the ball, which would be the opioid, would go into the glove, which is the receptor on the brain, and it would catch it. And if you take something like naltrexone, which is the pill, or Vivitrol, which is the 30-day injectable, it almost just puts like a frying pan above in front of the baseball glove. So the opioid just cannot bind to the receptor. Baseball cannot get to the glove to activate it. And so it's just a literal block. So you could take opioids and you would get no effect. Other medications that exist for opioid use disorder are the agonist treatments. And so methadone has been around for a while, which is it is an opioid, but it's kind of more controlled. It's given on a daily basis. Really, within the past 20 years, we've seen the emergence of buprenorphine or Suboxone, which is a partial opioid that somebody can take, and it has many benefits over methadone. It could be given, on a monthly script. It's very hard to overdose. It does not have any side effects. Now, those are really for alcohol and opioid use disorders. There are a lot of off-label medications that can also help reduce things like cocaine cravings, marijuana cravings, Topamax for cocaine, and acetylcysteine for marijuana or cannabis. They're not FDA approved at this point, but the data is still pretty supportive. So we can use a lot of these off-label medications. So in addition to your standard detox, peer supports like AA, NA, and any sort of outpatient-based therapy, just knowing that there are now medications on the market to help with substance use disorder, I think is a huge item in the arsenal for dealing with substance use disorders.
I'd love to have you expand a little bit more on peer intervention, and maybe you could talk about how important early intervention is, and when family members or loved ones should get involved.
I mean, I think it's probably safe to say that early intervention is really the most important thing. This can become problematic when a family member doesn't want to alienate or aggravate, let's say another family member who's using substance use disorders. And so the whole idea about keeping quiet, but early intervention is really the most important thing in the sense that if you think about what can happen to the long-term medical consequences of any sort of substance use disorder, I mean, the obvious one being death, but organ failure, loss of job. The other thing, again, that I can speak to practicing in corrections is if you get involved in the criminal system, it's very hard to kind of remove yourself from that, not necessarily that lifestyle, but just trying to break out and now having a criminal history with some sort of drug-related charge can just make life so much more difficult. So, I mean, the old saying that an ounce of prevention is worth a pound of cure, I think, is certainly important in a substance use disorder. And so, again, the family members really need to get involved as soon as possible if they can. And there are a lot of ways to do that through these peer supports. So groups like Al-Anon. The other thing I'll say too, though, is that now in a lot of the primary care offices, they are doing substance use screening. And this is being shown as being very effective in the long run. So even if a patient cannot see somebody who is board certified in substance use disorder, just picking it up on the initial screening is showing so much of a better outcome, in the long-term studies of having these devastating consequences of substance use disorder.
I want to thank Dr. Stroud for joining us today. We hope this discussion can help you or someone you know. Blue Cross Blue Shield of South Carolina members can call the phone number located on the back of their insurance card for mental health resources. We hope you'll join us again for our next Ask a Therapist discussion.